The marine collagen advantage. Marine collagen brings a specific advantage for older adults that other sources simply don't offer. Derived from the skin and scales of fish, its peptides are naturally smaller and lighter in weight than those found in animal bone. This means that instead of forcing the digestive system to work hard on breaking down long, bulky protein chains, marine collagen is already offered in a form much closer to what the body can absorb. For seniors who face slower digestion and weaker enzyme production, this difference makes marine collagen hydrolysates far more efficient for supporting muscle scaffolding and repair. Collagen doesn't act on muscle fibers directly. Rather, it strengthens the connective architecture of ligaments, tendons, and the intramuscular framework that keeps fibers coordinated. If that architecture becomes weak, new protein synthesis can't produce the same strength or stability. Bone-derived collagens tend to arrive in the gut as large, packaged molecules that overwhelm reduced enzyme capacity and linger without full absorption. Marine collagen, processed into hydrolyzed low molecular weight peptides, arrives as streamlined packets, ready to cross the intestinal wall quickly and enter circulation. Clinical reviews note that peptides in the range of 2,000 to 3,500 Daltons show superior pharmacokinetic profiles, moving into plasma faster and providing greater exposure over time. When older adults consume these smaller fragments, more of the material actually reaches the tissues where it matters. Comparative studies monitoring absorption rates have measured how hydrolyzed marine peptides appear in the bloodstream sooner and in higher concentrations than non-hydrolyzed collagen from land animals. The difference comes down to structure. Digestion is less of a barrier when peptide chains are already short and flexible. With age-related reductions in stomach acid and diminished function of proteases, breaking down bulky gelatin fragments becomes even harder. Marine collagen bypasses that roadblock. For seniors who often feel sore longer and take days to bounce back from normal activity, using a collagen form that shortens the lag between intake and tissue repair can translate into more mobility and less frustration. One of the practical ways to see this benefit is after exertion. Many older adults notice that gardening, lifting groceries, or even extended walking brings on prolonged soreness. That delay comes not just from weaker muscles, but from connective tissues struggling to replace worn collagen. Large, slow-to-digest collagen molecules provide little immediate support in these situations. Hydrolyzed marine peptides, on the other hand, absorb rapidly, integrating into tissue sooner. Muscle decline and aging is partly driven by slow repair cycles that fail to keep pace with natural wear. When collagen can circulate more efficiently and feed repair pathways on time, those cycles tighten over weeks and months. This difference can add up to maintaining rather than losing ground. It isn't just absorption speed at play. Fish-derived collagen also has a slightly different amino acid arrangement. Like other collagens, it is rich in glycine, proline, and hydroxyproline, but the way they are incorporated into peptide chains makes them more accessible. Processing fish skin tends to leave chains shorter, and in some cases enriched with peptide sequences that the intestine easily transports. Aging digestion, with reduced acid levels and lower protease activity, benefits from this head start. Instead of exhausting an already limited enzymatic system, hydrolyzed marine peptides cooperate with it. This makes them practical not only in theory, but in daily reality, where every calorie and every gram of protein has to count for more. Clinical reviews reinforce these observations. Research notes that smaller collagen peptides exhibit superior pharmacokinetic properties, with specific dipeptides such as Ala4-HIP and 4-HIP-GLY appearing prominently in plasma after intake. These fragments, weighing under 3,500 Daltons, remain detectable for hours and provide continuing access to tissues requiring collagen rebuilding. That ongoing presence matters because connective structures are constantly under stress, even at rest. By supplying collagen peptides with higher plasma availability, marine collagen works as a renewable stream feeding tissue maintenance. Over time, this means not just shorter recovery windows after activity, but also stronger daily resilience against small strains and micro tears. This efficiency is critical for older adults who often consume less food overall. Reduced appetite with age makes it harder to reach nutrition targets and meet protein requirements. If collagen intake is inconsistent or poorly absorbed, the body can't use it effectively. Marine collagen offers a solution. Every gram yields more benefit because more of it survives digestion and arrives intact in the blood. That efficiency turns a small bowl of fish skin broth into a meaningful delivery tool, while bone broth often remains largely symbolic rather than restorative. Seniors who rely on smaller meals especially benefit because a smaller serving of hydrolyzed marine peptides still translates into significant connective support. Equally important is bioavailability. In nutrition, it isn't just the amount consumed that matters, but the fraction that integrates into the body. For marine collagen, studies indicate that hydrolyzed low-weight peptides can achieve higher overall uptake, translating into improvements not just for skin and joints, but for muscle and tendon structure. For sarcopenia prevention, these tissues act like anchors during every movement. If collagen-rich fibers are maintained, muscles contract more efficiently, balance stabilizes, and coordination improves. Seniors supplementing with marine collagen often describe better grip strength or enhanced steadiness, reflecting this improvement in connective resilience rather than just muscle bulk. A caveat is necessary. Marine collagen is derived from fish or sometimes shellfish sources. For anyone with seafood allergies, fish skin broth or fish-derived supplements may cause reactions, ranging from mild sensitivity to more severe outcomes. In these cases, it is important to avoid marine collagen and consult a clinician for safe alternatives. Supplements and broths should never replace medical guidance, especially where allergies or chronic conditions are involved. Quality and sustainability are also worth noting. Marine collagen has the advantage of being produced from parts of fish, like skins and scales, that might otherwise go to waste, making it a more sustainable choice compared with some livestock collagens. However, not all products are regulated equally. Processing standards vary, and contamination can be a concern if sources are not carefully managed. To reduce risk, it is wise to choose reputable suppliers, or for those making broth at home, to use fresh fish skins from a trusted fishmonger. Clean sourcing ensures that the benefits of collagen come without unwanted impurities. Timing also plays a role in how effective a collagen source feels. Tissues are most primed to rebuild immediately after activity, yet most bone-derived collagens arrive in circulation only after a long digestion process. Hydrolyzed marine peptides, being smaller, move into plasma sooner and align more closely with that window of opportunity. For older adults with slower recovery mechanisms, this more precise timing matters. Over time, it can mean the difference between recovery that supports continued activity and recovery so delayed that activity itself becomes limited. Considering all these dimensions, peptide size, absorption speed, bioavailability, and digestibility, marine collagen provides older adults an advantage that bone broth simply doesn't match. It is not framed as a cure or a standalone fix, but as a practical tool tailored to the physiology of aging digestion. Every year, the ability to absorb nutrients wanes, making it crucial that what is consumed is usable without excess strain. Marine collagen meets that requirement by offering hydrolyzed peptides in a size and form the body can capitalize on immediately put together. This explains why older adults who incorporate marine collagen often see differences in mobility, recovery, or day-to-day stamina that traditional bone broth doesn't provide. The benefits accrue gradually, reinforcing tissues with each consistent intake. And over longer periods, this means extended independence and reduced fragility. While general dietary protein targets remain important, the form and function of collagen chosen make a measurable difference in how well muscles perform and recover. What remains now is to consider not just absorption, but quantity. Even with superior bioavailability, the actual amount of collagen in a serving determines whether the body meets its increased needs. That is where comparing different broth sources becomes important, because older adults often assume all bowls of collagen-rich stock offer the same value. In reality, the collagen provided by fish skin broth often surpasses what bone broths typically deliver, creating a much clearer picture of which choice better sustains muscle health. Fish skin broth versus bone broth collagen levels. When comparing broth sources, the differences in collagen levels become critical to understand. Bone broth has long been promoted as a practical solution, but its actual collagen content is modest and inconsistent, often delivering just small, single-digit grams of gelatin protein per serving. The yield fluctuates depending on the type of bones, simmering time, and preparation method, which means seniors relying on it may receive far less usable collagen than they expect. For someone past 60, where daily collagen production is already dropping and breakdown is accelerating, this irregularity leaves gaps that diet alone cannot easily repair. Fish skin broth presents a more concentrated option. Skins from species like salmon or cod contain dense collagen structures that release significant amounts during cooking, producing a broth with consistently higher levels compared to standard bone preparations. What makes this especially valuable for older adults is not only the quantity, but also the form. Collagen from fish skins breaks down into smaller fragments, known as low molecular weight peptides, that the body digests and absorbs more efficiently. For seniors with slower digestive pathways, this higher bioavailability enables a greater proportion of intake to be converted into actual support for connective tissues and muscular scaffolding. Clinical trials provide useful context about what these intake levels mean. Most studies that documented improvements in muscle strength or body composition used between 5 and 15 grams of hydrolyzed collagen peptides per day, delivered in a standardized form. Reaching those effective ranges from a typical serving of bone broth is improbable, since even generous servings may not reach this level and vary drastically by batch. By contrast, concentrated broths derived from fish skins or other high collagen tissues such as poultry feet come closer to bridging that gap in a single portion. For practical use, this means seniors are more likely to achieve the intake linked with positive outcomes when selecting marine collagen or targeted high-yield sources, rather than relying on bone broth alone. This comparison highlights more than just numbers. Bone broths from beef or chicken do carry benefits through their unique collagen types. Beef bones supply type 1 and 3, important for skin and gut tissue, while chicken yields primarily type 2, which supports cartilage and joint flexibility. Fish collagen, however, is predominantly type 1, the form that reinforces muscle-related connective frameworks. Because marine collagen also absorbs more efficiently, it supplies this crucial type of protein in a way that aging bodies can actually put to use. For seniors managing sarcopenia, that match between collagen type and absorption capability matters just as much as the absolute amount consumed. Reliability is another part of the equation. Bone broths often require long simmering periods, sometimes a full day, to release collagen, and even then results differ. One batch may gel well, another may not. Fish skins, by contrast, are inherently dense in collagen, and a shorter cooking period reliably produces a gelatinous, collagen-rich broth. This consistency reduces guesswork. Older adults benefit when their daily intake does not depend on variables like simmering time or bone quality, but instead on a steady source that delivers similar results cup after cup. Some alternatives, such as chicken feet broth, can also provide higher collagen yields, as these tissues are naturally rich in connective material. While nutritionally useful, however, their preparation and availability are less common, and the collagens they supply are not absorbed as readily as marine peptides. Fish skin broth, therefore, maintains an advantage not only in potency, but also in real-world accessibility for those seeking convenient, consistent options. This is particularly important for individuals with reduced appetite, as one concentrated serving may help approach therapeutic intakes without requiring large food volumes. Another issue worth clarifying is that collagen in broth exists alongside other proteins and minerals. In bone broth, this dilutes the ratio of collagen to total protein. While nutrients like calcium, magnesium, and amino acids contribute general support, they do not substitute for concentrated collagen peptides in studies examining sarcopenia mitigation. Fish skins, however, prioritize collagen naturally with less nutritional dilution from other bone-derived compounds. This targeted nutrient density translates into more of the supportive building blocks seniors specifically need for maintaining strength and connective stability. The implication is straightforward. Many adults maintaining a bone broth habit may believe they are addressing sarcopenia risk, yet the collagen levels they actually consume often land below effective ranges. Fish skin broth and other concentrated sources, by delivering higher collagen content in more bioavailable forms, give older adults a more realistic chance of matching the intakes that research associates with measurable improvements. This isn't a guarantee, since outcomes depend on diet, exercise, and overall health, but it does mean that the nutritional foundation better aligns with what the body requires to maintain resilience after 60. Understanding this distinction removes much of the frustration many feel when their habits do not lead to expected changes. Collagen intake is not just about having any source. It's about having one that both reliably delivers and efficiently absorbs. Bone broth has cultural value and comfort, but in practical terms, it does not consistently provide collagen in the amounts or forms necessary to match the demands of aging muscles. Fish skin broth fills that gap more effectively, offering seniors a strategy that reduces both variability and insufficiency. The broader takeaway is that not all broths are equal. For seniors, the choice of base ingredient carries real consequences for whether their daily effort contributes meaningfully to muscle support. Collagen type, yield, reliability, and digestion all combine to determine results. Relying on low-yield broths means investing time and effort without receiving the support needed, whereas opting for concentrated, bioavailable sources helps close the shortfall and move closer to intakes consistent with research findings. In framing this comparison, it is not about dismissing bone broth altogether, but understanding its limitations and clarifying expectations. Comfort and hydration it provides, clinical collagen support it rarely achieves on its own. Replacing or complementing it with marine broth makes it easier for seniors to approach the effective peptide ranges seen in trials without the impractical task of consuming large or multiple servings daily. This subtle but important adjustment can sharpen the effectiveness of a routine aimed at preventing muscle decline. By weighing not just tradition but actual collagen delivery, seniors can make better decisions about which daily habits truly serve their long-term health. The right choice ensures that the commitment to prepare and consume broth pays measurable dividends in connective stability and strength support. Choosing concentrated, bioavailable forms like fish skin broth allows older adults to match their daily intake with what scientific evidence associates with real benefits for recovery and preservation. And this isn't the only nutritional edge fish skins bring to the table. Beyond collagen, their composition introduces another element that bone broth entirely lacks, an additional nutrient that influences inflammation, protein synthesis, and recovery speed, with direct consequences for aging muscle. Omega-3s, the secret recovery booster in fish skin. Fish skin broth stands apart from other collagen-rich foods because it also delivers omega-3 fatty acids, specifically EPA and DHA. These fatty acids give seniors a type of support that goes beyond connective tissue repair.